We're now being joined on News at 10 by Dr. Ayo Oluwole. He's a public health physician to look at how to stop the spread of Lassa fever. Now, it appears we have over 200 cases and about 41 deaths, and that also includes medical personnel.
Yes.
How do you think this can be brought under control?
Thank you for having me. Well, we've seen an increase because as of January 24, 2020, we found about 195 cases and about about less than 41 deaths now. And now we've had more than that in just a short period of time. So we need to intensify our efforts at prevention, putting out information, right informations out there into the public, and then ensuring that people are getting the right informations as we are putting out today. The Lassa Fever outbreak is one that is spreading over 11 states now, with higher numbers in some states and some lower states. So we need to intensify efforts in identifying cases, telling people to get out fast as soon as possible. More than 48 hours of fever should be a high index of suspicion for any health practitioner treating, and also a patient to quickly get out and then find some other
So a lot of awareness for health practitioners,
yes,
especially. But it would also appear that the fever has become a yearly ritual. We have in 2019
yes,
it happening between January and February,
yes,
and you know, something between December and June, and we have it now. Is it the dry season? I mean, why do we have it recur every year?
Yes, so Lassa fever is endemic in Nigeria and in some other West African states. So we have now transmissions of the virus throughout the year, so that's established. But between the November and May period, we have a spike in transmission because of the weather, because of the dry season, and because of some human practices also, which has advanced interactions more with the rodents that carry the virus.
Looking at the number of states, you said 11, about 15 states affected. How do you think citizens can protect themselves and also ensure that some of these states that don't have it or haven't detected any of it, you know, can protect themselves better?
Yes. So first of all, we need to put out there to the general population that people need to stay away from interactions with the causative organisms and through the rodents, which is the multi-mammate rats, okay? And contact, we know that contact with urine, with infected urine, blood, you know, of these rodents are what gets us involved with this virus. So we need to ensure that we keep away, we keep our food safe, we keep our food in rodent-safe containers. We avoid contact with persons who are coming from probably states, you know, that's another way to curtail. Lagos states have not recorded a case, okay? So we need to be on high alert for persons who are moving from state to state and they are ill, okay? Hospitals and healthcare professionals need to take travel history, very, very important, and then ensure that they have a high risk index of suspicion when they are seeing those cases.
So far, based on what you know, the country is doing, most of the cases reported have been treated at the specialist hospital Irua, that's in Edo State.
Yes.
Would you say that we're prepared as a country to adequately handle this? Because we know that even in 2018 and during the dawn of the Ebola, there was a sort of national action plan for health, you know, the federal government. So do you think we're really positioned, poised and prepared and ready to really tackle this head on?
Yes, I think we should move away from having emergency responses. Yes, emergency responses should come when we have outbreaks, but should also have sustained responses to these viral hemorrhagic fevers, because we've seen them coming year in, year out, and there's always an action when we have outbreaks. But there needs to be sustained surveillance. We need to put facilities into proper, like you just said, Irua specialist has capacity. We need to improve other capacity for other hospitals, teaching hospitals, to detect and to treat cases as we find them, and also to intensify surveillance and find the reasons, okay, because we've not found the reasons why we keep having these outbreaks. Okay, the direct causes, we know the direct causes, but why do we have these outbreaks coming year in, year out? So we need to, and that can be done, answers can be done through surveillance, continuous surveillance and continuous education of the masses. Also,
some people have talked about community engagement, and exactly. You've mentioned promoting hygienic conditions and other control measures, but looking at all of this, the U.S. Center for Disease Control said we're looking at 100 to 300,000 cases, and last year it was about 5,000 deaths. I mean, when you look at moving forward to handling this, what more do you think people should be doing, especially people who perhaps argue that maybe rats have been living with us since time immemorial?
Yes, well, the interactions with rats and rodents and humans have long been documented. And we know that human behavior has also influenced our further interactions. We keep having our bush burns, we keep having cities encroached, we keep encroaching into their natural habitat. So the interaction between these rodents and human populations are getting smaller. We practice we have poor sanitary practices. Environmental sanitations are poor, especially in congested cities like Lagos. And human behavior, also affects all of these things. So yes, we have a lot of cases and a lot of deaths, but we as the people, as the government, need to ensure that we put in measures, sanitary measures, to keep our environment clean. If these rodents don't find a good place to fatten up, they would not be coming into our midst. And if we don't go into their residence and their place of abode, we might not be having much more interactions.
All right, increased emergency measures. We'd like to appreciate you, Dr. Ayo Oluwole. Thank you for talking to us on News at 10.